Still on the troubles in the health sector, there may be white smoke on the horizon ahead of the looming doctors' strike that is expected to begin on the 21st of December. Crisis talks aimed at resolving the contentious issues began today with the National Assembly and Senate Health Committees mediating. The 5-hour-long session saw the National Treasury commit to release 520 million shillings required for the comprehensive health insurance cover for doctors in the referral hospitals, even as NHIF and the Ministry of Health were tasked to put in place the structures of ensuring that all healthcare practitioners receive adequate cover. Chemtai Goin has the details.
An issue discussed with
As the clock ticks towards the December 21st, when doctors are set to down their tools, frantic efforts are underway to forestall the strike.
There is no way you can motivate your employees without even addressing such issues like their medical health care.
Perhaps the ministry needs to start looking at the policy change on how we run healthcare in this country. This crisis has exposed our underbelly, and we need to act in such a manner that in the future, any such crisis will not lead to the suffering that we are going through at the moment.
The focus should be PPE distribution to all other healthcare facilities by the Ministry of Health and Council of Governors, level 2, level 3, level 4 and 5 facilities. That is where the focus by government should be, because that effort in isolation and treatment centers has already been taken care of by the COVID fund.
It's important to know that we are still waiting for EACC authorization on the kits that they did tell us to hold as they continue with their investigations.
When the kitchen became too hot, government departments traded blame over who should be held responsible for the mess that has already paralyzed service delivery in public hospitals.
The National Assembly gave you money, 576 million, to be able to take care of the health workers, and then you did not spend that money.
The budgetary allocation was received at the end of the financial year in the 4th week of June 2020, and therefore the ministry was unable to disburse those funds and has since requested for revoting of the funds and the supplementary estimates.
According to our records in the National Treasury, the ministry did not request for 576 million in the financial year 2019-2020. In the absence of an exchequer requisition, we wouldn't transfer money to an institution. So that is on record, and that is the position. Now,
just hold on, and I'll give the member.
It's a point of order here.
Yeah, just hold on 1 second.
We are in a pandemic. Everybody must mobilize until the last coin to go in supporting the health workers.
But despite the push and pull, well aware of the grave situation, Treasury pledged to ensure the 520 million shillings required to initiate the process of procuring medical cover for the healthcare workers was disbursed.
In 7 days, we will make that 520 million available.
The Ministry of Health, they have confirmed that the transfer of the 520 million will be done within 2 days. That will be around 19 December. NHIF also, they have made commitment and they have updated. They've told us that they are going to cover the medical staff by 20th January 2021 upon receiving the money.
Proposal by NHIF, central pooling and everything, we supported it last time and we still support. And we are agreeable that those that are not covered should be covered.
And while counties have consistently blamed the National Treasury for the stalemate due to the delayed disbursement of resources, the committee was puzzled by reports that the devolved units were holding unspent 42 billion shillings in their accounts.
When we look at the balances that counties have in their bank accounts, because we monitor that daily, the counties have 42 billion Kenya shillings in their bank accounts.
We have votes on accounts. You really cannot expect a county government to tap on other accounts so that they pay the statutory deductions.
The committee also directing Laikipia Governor Nderetu Mureithi to reinstate 34 doctors he had fired for downing their tools last year, even as they warned him of sanctions.
The Senate can overrule a court of law.
The dispute between Kirinyaga Governor and 72 sacked doctors was referred to the Public Service Commission for resolution. Chemutai Goin, Citizen TV.